go to, the majority of patients we see are geriatric patients and elderly patients in the community whose care is deteriorating. Kids are generally really healthy, which is great, but it means we see them less and we're less comfortable with them, and our curriculum doesn't really focus on them. So I want to introduce you to Tony. And Tony's 4. And you're caring for Tony because Tony has croup today. But Tony's mum goes, hey, by the way, Tony, who's a boy, has been playing with girls' toys a lot. Should I be worried about that? And now that's a loaded question. It's an innocent question from Tony's mum, but it's a bit of a loaded question. Like, should I be worried about that? And the answer is obviously no. But the reason it's no is because of a thing called gender variance. And basically, it's totally normal for young kids to play with toys that aren't typically associated with their gender. So it's totally normal for a boy to play with Barbie dolls, and it's expected. And it's actually totally normal for young boys to wear dresses and young girls to play with, Spider-Man, because these are sort of typical things that we've associated with a gender role. And they're social constructs essentially. But more than being social constructs, the gender variance that we see in young people tends to fade away because our society teaches people about these gender roles and social constructs that people tend to conform after a while, which is a bit sad if you're coming from a sort of sociologic perspective and a very pro-LGBTQIA perspective. But the reality is that even if someone, let's say Tony, says, I want to be called by a girl's name every now and again, even that often doesn't last into puberty. And so when we talk about gender variance and young kids exploring gender roles which aren't typically associated with their gender and their sex, that's totally normal. And 9 out of 10 kids who in their very early childhood are brought to the doctor and, doctor, is something wrong with my boy? He's playing with girls' toys. They don't end up as non-binary or transgender adults.
It's interesting as a parent, and having 4 kids myself and having various different situations at different ages with my kids. My eldest son, when he was young at preschool, I used to paint my toenails every Friday night. And my son used to come up and just be so excited about painting his toenails. So every Monday he used to go to daycare with his toenails painted. And then we go into daycare and the teachers at daycare, it's like, oh, Jack, what color are your toenails today? And it was just a normal thing because it was bright colors, and it was just a completely normal thing in our household that Jack had his toenails painted. And eventually he grew out of it, and that was it. It was just bright colors, and it was toenails and fingernails and whatever, and I think the recognition of various things like that, as a parent, and seeing other children at various stages. But I know there's a lot of paramedics out there who don't have children and don't have a lot to do with children, don't necessarily have the same experience as what I do with kids. My daughter has a baby doll that she calls Leo, but Leo's a girl, and that's Leo, the doll. Like it's,
Kids
and it doesn't,
kids aren't imprinted with our sort of social norms of gender. And that's just kids. Like, kids are just being kids.
Exactly.
And there's something really cool about being able to interact with a kid and go, and you've got a young boy and you go, oh, that's such a cool color. Show me that color that you've got in your toenails. And they get so excited, they forget about the fact that they've got a Achilles fracture in their arm. And so
Totally.
I'd encourage that. And then the thing is, people get worried though. What if my kid ends up transgender? And it's like, first of all, there's nothing wrong with that. But two,
Exactly.
you don't have to concern yourself with that. Like
Yeah,
we can cross that bridge when we get to it.
yeah,
Um,
yeah. It's
because gender,
yeah, I was just going to say it's interesting because my daughter's neurodivergent, and I've had various conversations with different parents who often come to me because I'm quite vocal about the fact. I mean, this is slightly off topic, but it's
mm,
similar in what we're talking about here. It's like, my child does X, Y, Z. Should I be worried about that? And it's
mm,
like, um, when we're talking about neurodivergence and when we're talking about different behaviors, they all have to do with the development of the child. And it's whether the child progresses past different stages of development. And the same would be true when it comes to gender. And my response is always, that's the normal progression of the child. I wouldn't be worried about anything. You just
yeah,
enjoy and embrace your child, and
totally.
just love them and don't worry about anything.
100%.
Just,
100%.
that's
100%. And it's funny you speak about neurodivergence because we know that there is a strong overlap between neurodivergence and
Mm.
diversity of gender and sexuality.
Yes,
Um,
yeah, yeah.
and I guess talking about, the case of Tony, um, that's it's probably important that we talk about the different layers of what we're talking about here, because we've talked about identity and sex and gender and orientation and expression, and then there's this beautiful genderbread person by Sam Kilman, and I love using this to explain and explore the different components
Mm,
that we're talking about. Um, and this is cute sort of photo, and gender identity is essentially your brain, your mind. It's I wake up in the morning and before I open my eyes, how do I see myself? You know, do I believe that innately I am male, I am female, or I'm not non-binary?
mm,
So neither male nor female. And what we've realized is it's probably a spectrum. And everything I'm going to talk about here
mm,
it's a spectrum. More male, more female, on either end or sort of in the middle of non-binary. And so gender identity is how I see myself. Then I've got gender expression, which is the gender variance that we're talking about now. It's how do I express myself in the world? Do I wear dresses? Do I wear pants? Do I wear, you know, clothing typically associated with boys, clothing typically associated with girls? And it's all social constructs. But the way I express myself in the world is also the pronouns I use, the language I use, the name I might choose to have people call me by. It's how I am in the world around me. Um, so if I lived in a cave my whole life, there would be very little gender expression. But the way I interact with society is my gender expression. So how I dress, how I talk, how I act, the words I use to refer to myself, the language I use, that's gender expression. Um, then sex is an interesting one. So when we talk about sex, we're talking about biological sex. And there's a few components to this. So when we talk about biological sex, there's your DNA. And certainly we know that there's XX chromosomes, XY chromosomes, and there's also chromosomal abnormalities. So some people have additional copies of some chromosomes. So they might be XYY or XXY. And that's your DNA. But your DNA doesn't instantly become your physical body. It has to be expressed by proteins. And so some people will have male DNA, but they won't have the right genes inside their DNA to encode proteins for male hormones. So you can have things like an SRY deficiency, which means that you don't produce testosterone. So you can have someone with a male chromosome, an XY chromosome, who, because the fetus is not exposed to testosterone, develops with a female body, a uterus, a vagina, and so grows up and looks like a woman and has the anatomy of a woman, but their DNA is that of a man. And that happens a lot. And
mm,
there's also a variance of that. So you have a lot of people who are intersex, and intersex used to be, we used to use a word which you don't use anymore. It's because it's quite offensive. It's hermaphrodite.
Mm.
And that was from the Greek. But intersex essentially means that your physical sex characteristics, and your physical sex characteristics are things like your genes and your DNA and your proteins and the organs inside you and the shape of your body, that those are, in the case of intersex people, neither entirely male nor entirely female. And people go, oh, but that must be really rare. And it's like, well, yes, it's rare, but it's about as rare as being redhead.
Which is
So
not that
no, there are probably as many.
around.
Yeah. If you think about the population of the world, there are as many redheads as there are intersex people, roughly.
Wow.
Yeah. So it's actually really common. And
Mm.
guaranteed you will have treated or will treat patients who are intersex. And some of them don't even know that they're intersex.
Wow. Mm.
Um,
That's really interesting.
yeah. And so when we start to understand this more, we start to go, hang on a second, scientifically, like from a very accurate scientific perspective, the division of either male or female doesn't really work out as cleanly
Mm.
and neatly as we'd like it
Mm.
to. There is
So,
actually physical sex characteristics which blur.
so questions when it comes to things like that, do these tend to come out when people are looking at things like fertility?
Yeah,
Did
oftentimes it does.
is it, does that come out when people are having issues with fertility?
So depending on how someone's physical sex characteristics have manifested differently, it might be identified at birth, where the
Hmm.
genitalia will be indeterminate. It might
Okay.
be identified during puberty, where there'll be a failure to progress through a sort of typical puberty.
Hmm.
It might be identified later on in life when someone is attempting to conceive with a partner and there are fertility issues.
Okay.
It might never be identified. There was a famously terrible study done uh, in the African continent where a team of researchers developed an ECG algorithm to predict whether someone was male or female based entirely off their ECG.
Oh,
And they
goodness.
then applied it to their Olympic athletes. And they found that one of their star female track runners had ECG findings consistent with a male heart. And then they ended up doing genetic testing and finding that she actually was intersex and had testes which hadn't descended. So her external body was one which we would typically, associate with being female, but she had two testicles which hadn't descended and were largely inactive in producing, a lot of hormone. They were producing a bit of hormone. Um, and unfortunately, she was banned from the Olympic team. They kicked her off the team. So it's totally
But she never
unethical.
knew. Yeah, she never
She,
knew before. That's awful.
horrible, totally unethical medical research, totally unethical practice. Um, and then what was interesting was the follow-up question was from the medical colleagues in that area was, from a safety perspective, do we need to operate and take those testicles out? Because traditionally speaking, we had conceived of testicles which hadn't descended as being highly associated with cancer.
Oh,
So
goodness.
if you have undescended testicles, it's thought that they tend to, develop testicular cancer at much, much higher rates.
Mm.
Um, we now know that in the case of intersex people, that's far less likely to happen. Um, and so many will suggest monitoring and not surgical intervention. But that's sort of going off on a tangent here. I guess coming back to the point is that there are a lot of people in our community whose physical sex characteristics, and that is their organs, uterus, ovaries, testicles, penis, um, might not be entirely male or female, and that also, um, even despite those organs on the outside portraying one thing, there can be organs inside which don't typically match.
Hmm.
And even if there aren't, a non-matched organs, there can be still things on a, cellular level when we talk about genes and DNA, which don't quite match. And that's completely natural because it happens in nature at a very high frequency. And so we don't, everyone has sort of come on board with gay and lesbian and trans, but we don't talk about intersex people enough. And they're a large proportion of our community. And they also receive really terrible care because we don't know about them, we don't talk about them, and we don't design medical interventions for them. So, we're still stuck in a male-female binary. And so if we come back to Sam Killerman's genderbread person, the last thing here is sexual orientation. So sexual orientation is who I'm attracted to. And we talk about it last because you have to know who you are and what you identify as and how you identify before we start talking about sexual orientation. Because it sort of starts to break down a bit when we go, well, if I don't have a binary gender, if I don't see myself as male or female, and I'm attracted to a woman, what does that make me? It doesn't fit neatly in the box of, oh, this person's gay, this person's a lesbian, this person's straight. And unfortunately, the human brain likes patterns and it likes rigidity, and our society likes boxes, and that tends to break down a bit because the reality is it really doesn't matter that much. From a clinical context, when we talk about, what's important in medicine, we actually don't really care how someone identifies. We're looking at behaviors. So we talk about MSM in medicine, men who have sex with men. And more than that, we should really be talking about penetrative sex, anal sex, receptive anal sex or penetrative anal sex, receptive vaginal intercourse, penetrative vaginal intercourse, because they confer different risks for the transmission of bloodborne viruses, risks for things like, rectal cancer, risk for things like STIs. It doesn't matter how someone identifies. If I go, oh, I don't really drink much at all, but oh yeah, I guess I drink, 30 beers on the weekend. Oh, I'm not a drinker. I don't drink every day. I'm a binge drinker. On the weekend, I go and I binge 30 beers. Now, thankfully, I don't like beer, and nor do I, I'd be unconscious if I drank even half that. But it's the behavior, it's the actions which we want to focus on from a clinical risk sort of stratification perspective, not the identity. So orientation probably doesn't play into a lot of what we're looking at from a risk perspective, but it does insofar as we know that people who identify as gay and lesbian and bisexual and pansexual have increased rates of risk. And so from that perspective, it's important to them, and therefore it's important to us. And so again, we've got gender identity, which is brain, woman, man, non-binary. We've got gender expression, which is how I portray myself in the world. Do I portray myself in a masculine way, in a feminine way, or in an androgynous way? We've got biological sex. We've got male, female, and intersex. And then lastly, we've got sort of a sexual orientation perspective from heterosexual to homosexual and bisexual in between. And recently people have been asking me, well, what's the difference between bisexual and pansexual? And the truth is that you don't have to worry too much about the difference. Essentially, if you understand bisexual as not breaking people down into, oh, I specifically like men and women, and pansexual as being perhaps even more sort of open-minded than that.
Pansexual, from my understanding, and please correct me if I'm wrong, is you are attracted to the individual. So you would be including people who were intersex and non-binary into the equation, as opposed to so it's just everyone. Bisexual
essentially
just if you're looking at a specific definition, really.
To be honest, it's really a very sort of semantic thing, and I would just encourage people not to worry too much about it. If someone says they're bisexual, great. And if someone says they're pansexual, great. Just understand that it means all
Yeah.
people rather than I'm heterosexual,
Yeah.
in which case I like the opposite sex, and I'm homosexual, in which case I'm attracted to the same sex.
Yeah.
Yeah.
Yeah. Yeah. Yeah.
Um, so if we bring it back to sort of practicality, we talk about Tony. So Tony's 4 years old. And if I ask Tony, do you feel like you're a boy or girl or neither? Tony goes, oh, I'm a boy. Okay, great. That's his gender identity. And then if I were to examine Tony, Tony has testicles, a penis, typically male characteristics. If we, were to go and test Tony's DNA, it would come back as XY. And so we can say, okay, Tony's biologically male. And then Tony is playing with girls' skirts and trying them on and dressing up. So that's totally normal. That's gender variance. But that comes under gender expression. So, that's how people are portraying themselves. So it's a variance gender expression. And then we're not going to talk about orientation because Tony's 4 years old.
Yeah.
Yeah, that'll come way later on.
Yeah.
And so gender variance is completely normal, but gender dysphoria is the clinical issue which needs treating. And gender dysphoria arrives from, and the word dysphoria comes from dys, meaning bad or problem. It is the intense stress and distress that comes from when your body does not match your identity. And so someone who is transgender typically experiences gender dysphoria because it's incredibly stressful to be a woman stuck in the body of a man, for example. And so that's what we are looking to help. And that gender dysphoria produces a whole lot of sort of domino effects in terms of ill mental health. And also when someone starts to change the way that they express their gender, that attracts a lot of abuse from society still, which is not helpful to mental health. And so there is a comorbidity of mental illness that occurs with gender dysphoria because it is intense stress and intensely distressing. And what we now know is that gender variance is expected in most children, frankly, but gender dysphoria is not something that we expect. We don't expect a 6-year-old to be in tears on a regular basis because they feel that they are a boy, let's say, but they have the body of a girl. That's not normal. Now, what's not normal there is that they are so distressed because kids should not be that distressed. What they need is support. What is interesting is that we know that if someone has a gender identity which is not congruent with their physical sex characteristics, if that is still the case at Tanner stage 2 of puberty, then that's it for life generally. And by that, what I mean is that people often say, oh, well, children are changing constantly and we can't know, and who knows, they'll change their mind when they're older. What we do know is that once you hit Tanner stage 2 of puberty, you don't tend to change your mind. That tends to be it for life.
How old is that? So what are the stages of puberty, just quickly, so that
so the Tanner stages, there's basically like a few core stages. And when we talk about Tanner stage 2 of puberty, we're essentially talking about breast budding, testicular enlargement, perhaps the first signs of hair in the armpits and around the groin. It's the first physical, like observable signs of puberty that one sees that happens after the growth spurts. So there's no age that is specifically associated with it.
So it's just the stage of where they're at and what's happening to their bodies at that time.
Yeah. It's the early changes.
So when that starts to happen, and they're changing into the mature version of the sex that they are, that's when that dysphoria starts
It's not necessarily that. That's
really,
when the distress and dysphoria tends to get worse because you're starting to go through a puberty
yes,
that you
yeah,
really
yeah,
don't want to go through. But the
yeah,
dysphoria can start at any age.
yeah,
We know
yeah.
that some kids at a very young age know that they are trans. And
Mm,
some people only know later in adulthood.
mm,
But what we do know is that at that point, that's when the brain starts to change. And
yeah.
certainly, if you had Tony who is playing with girls' toys, we would generally expect that, at that point, if Tony's saying, no, I'm a girl, that if that's still the case, Tanner stage 2 of puberty, that's Tony actually has a female gender identity at that point, and that's
Yeah.
going to be the case for life.
Yeah.
Um, it's not a phase or a stage. And so gender dysphoria is clinically important because it requires medical assistance and
Mm,
social assistance.
yeah.
And so if we
Yeah.
go back a step and we talk about LGBTQIA, we've got lesbian, gay, bisexual, trans, queer, intersex, and asexuality.
Mm,
There's a few terms here which people might be more or less comfortable with. Queer used to be a sort of insulting term, but young people these days have co-opted it. It's now an
mm,
umbrella term. So everything under this umbrella of LGBTQIA plus can also be referred to as queer, as a sort of
mm.
rainbow community. We've talked
I've
about
noticed that a lot of
intersex.
people call
Yeah.
themselves queer now.
Yeah.
Yeah.
And it's a nice way of rejecting needing to put things in
Mm,
buckets and in boxes, because a lot of things tend to fall down when, particularly like sexual orientation sort of falls down when you are non-binary, because
mm,
it's probably an outdated social construct for many
yeah.
people. But one acknowledges that one's queer. And it's a nice umbrella term that is
Mm,
non-specific. It's not putting things in a box, but it's acknowledging that a person has an LGBTQIA identity and is a member of that community. And then the last thing here is asexual.